Fertility preservation or egg freezing is a procedure wherein a woman who wants to postpone their childbearing can consider freezing their eggs at a younger age so that they can use it at a later stage. Recently, I was in Indian Institute of Management for an entrepreneurship training. I came across various young women entrepreneurs who are very keen to know about this topic and came and inquired as to how to go about the procedure. That is when I realized the importance of this in today's scenario. Why do we only talk about egg freezing and not sperm freezing? What we need to understand is women are born with a very limited number of eggs, which is determined at the time of the birth. So as the woman ages, the number of eggs decrease as well as the quality of the eggs also decrease. Every month to ovulate one egg, we end up spending millions of eggs together. So these eggs are arrested at a certain stage of their cell division, and as the age advances, the spindles which are responsible for the equal distribution of chromosomes during the division, they break down. This ends up with unequal distribution of chromosomes, and this results in chromosomally abnormal embryos. So what happens to these embryos? Either they do not implant, that's why with age the fertility decreases, or even if they implant, it ends up with abortions, or sometimes it may end up with a chromosomally abnormal child such as Down syndrome. So who has to consider egg freezing? Any woman who wants to postpone their childbearing can consider doing the egg freezing. So when should they do, or how early should they consider doing the egg freezing? You can do this up to 35 years of age, but earlier you do the better. So I would personally advise you to do that before you turn 30 years of age. So how long can you preserve these eggs? It can be done for up to 10 years. Does the quality decrease? Not really. What is the procedure to do the egg freezing? So once you decide to freeze your eggs, you have to consult your fertility specialist who will get a few hormonal tests done for you along with an ultrasound scan. So from second day of your period, you'll be given a few hormonal injections that will last for about 8 to 10 days. And once your eggs are ready, you go through a procedure of egg retrieval. This is done under IV sedation. It takes about 10 minutes. It's a vaginal procedure done under ultrasound guidance. So after the procedure, you'll be sent home on the same day. There is no major surgery involved. Post procedure, you'll be very comfortable. And these eggs are frozen in liquid nitrogen, and they can be used whenever you want to go ahead with your fertility or childbearing.